Hello everybody, this is Dr. Langdon, board certified pediatrician, mom of 6, grandmother to 2, here today to help hopefully explain a lot of commonly used cough and cold medicine preparations and some tips and tricks. Number one tip, generic is fine. I want to teach you the actual active ingredient names so you will be able to be a savvy consumer when you're purchasing cough and cold medications. So several caveats. We don't use any cough suppressants under age 2. Multiple studies have shown that this is dangerous and it doesn't work anyway. So if they don't have the receptors to respond to a cough suppressant and the cough suppressant could cause some respiratory depression, that's a lose-lose situation. Another little tip is you guys may ask for a prescription cough and cold medicine when I'm seeing you for your child's viral upper respiratory infection. And the reason maybe I get a little frustrated or your pediatrician may get frustrated is every single thing that is available to us by prescription is more than available over the counter. So there's really not a need for us to prescribe you a cough and cold medicine. Now, certainly if the cough and cold medicine included codeine, a narcotic, that would require a prescription, but pediatricians don't prescribe narcotics for cough and cold, so I hope you understand why we don't want to do that. Another little caveat is if your child has asthma, we would never want to suppress their cough, which could be a red flag that they need a breathing treatment or 2 puffs on their fast-acting rescue inhaler. We wouldn't want to suppress that cough so you didn't realize that they were wheezing or maybe about to get into some respiratory distress and need to use their bronchodilator, an inhaler, or breathing treatment. Okay, so I just wanted to get those things out of the way. Now, one thing I want you to remember is that in cough and cold preparations, they could contain a medicine for fever, aches, and pains. So let's just learn some basic things. Tylenol is the brand name, but acetaminophen is the active ingredient. So acetaminophen is in a lot of different preparations, even those available for children. So for example, in the adult and older teen cough and cold medicine called Dayquil, cold and flu. That sounds very important. You've got a flu or a cold. This is what you need. You think, and it's fine, but the active ingredients are acetaminophen. What was that? Tylenol. So don't take Tylenol while you're taking Dayquil or the generic equivalent. Phenylephrine, that's a decongestant, and dextromethorphan. So the only cough suppressant over the counter is all dextromethorphan. Imagine if you abbreviated that, it would be DM, dextra, D, methorphan, M, DM. So when you see any cough and cold prep that says so-and-so DM, it just means that it has dextromethorphan in there, which is a cough medicine. So if you got, there are also preparations that are only dextromethorphan, like Delsum, an extended release DM, and that is only dextromethorphan, which is fine. If all you need is a cough medicine, you could do that. Most things are combinations though. So a lot of the combinations can include pain med or fever med, like that one had acetaminophen or Tylenol. Some contain ibuprofen. Ibuprofen, and you notice everything's generic. Generic's fine. I don't need a brand name for anything that I know of once you can read the active ingredients. Ibuprofen could be brand name Aleve. I'm sorry, not Aleve, that's Naproxen. It could be brand name Advil, that's what I was trying to say, or Motrin, but obviously generic is just as fine. So if you see ibuprofen in the active ingredients, don't take ibuprofen and that combo preparation. So you're getting the point here. Be very careful with your combo preparations. Now, this is the generic equivalent of NyQuil, brand name NyQuil. Remember, it has alcohol in it, so certainly this wouldn't be for the younger kids, but for older teens and adults, it's fine. Now, it contains, as it says, pain reliever, fever reducer, Tylenol, it's acetaminophen, cough suppressant, dextromethorphan. You see how simple this is now? An antihistamine, doxylamine succinate. So most of the ingredients are going to be cough medicine, dextromethorphan, pain or fever reducer, either ibuprofen or acetaminophen, a decongestant, but we have to be careful if we do a decongestant by itself at bedtime, it could keep you awake, and an antihistamine. Now, some antihistamines can make you very drowsy. Here's a quick, neat history in medicine. Antihistamines were discovered first. So the granddaddy of all antihistamines is diphenhydramine. That is Benadryl. So diphenhydramine is extremely powerful as an antihistamine, an H1 blocker. But the problem is it also has a lot of anticholinergic effects, which means it can make you drowsy. So that's why initially decongestants were discovered, because they're more of a stimulant. So an antihistamine just dries you up. A decongestant shrinks blood vessels. So because you shrink blood vessels, theoretically, it could increase your blood pressure. So you are not supposed to give your child a decongestant at the same time as they're on a stimulant medicine for ADHD. And you also have to be careful about taking a stimulant or a decongestant medicine around bedtime, because it could keep you awake. And so that's why a lot of the day preparations don't contain an antihistamine, because they can make you sleepy. And a lot of the night preparations don't contain a decongestant, because they could keep you awake. Is this starting to make more sense now? So a lot of the cough and cold combos sold for children are a combination of a decongestant, antihistamine, and cough suppressant, like, for example, Dimetap DM, things like that. So let's talk about the names of some antihistamines. The decongestants are typically just pseudoephedrine or phenylephrine. That's about all you got. So if it starts with a P, it's probably the decongestant. The antihistamines, the initial most famous one is diphenhydramine Benadryl. I also want you guys to learn this, because a lot of people pay for brand name Tylenol PM and all they need is to fall asleep. And all Tylenol PM is just acetaminophen plus diphenhydramine, the antihistamine. So just get your generic diphenhydramine, generic Benadryl, if that's what you need for falling asleep. Now, we don't want to do that long term. That would be for cases like jet lag and things like that. Lots of evidence showing that plain Benadryl really isn't great for us, especially in elderly people, has been linked with dementia and things like that. So take it easy on the Benadryl. But for short-term uses to help you sleep, or for an emergency panic attack, it can actually be very helpful, and certainly for allergic reactions, hives, things like that. So let's get back to those combos. Let's say you had a really strong cough and cold medicine with diphenhydramine in it. It's probably going to make you sleepy, so they'll have added a decongestant, phenylephrine or pseudoephedrine, right? Some of the combos, like Dimetap and ones like that, have brompheniramine as the antihistamine, or chlorpheniramine, chlortrimeton. Now, you know there are a newer generation of non-sedating antihistamines like Zyrtec, which is just cetirizine, Allegra, which is just fexofenadine, Claritin, which is just loratadine. And so some of those now have combo. Zyrtec D is the cetirizine plus a decongestant, or Allegra D or Claritin D, etc. And now that you know those active ingredients, you can look for those same active ingredients and get the generic and save a lot of money. So what I hope that you can learn is that you can buy generics. You can figure out exactly which symptom you need relieving, so you can specifically pick out what you need without wasting your money on ingredients that you don't need. Plus, you don't want the side effect of those ingredients if you don't need those, help, that sort of help for whatever's going on with you. I also want to emphasize with you that we are very, very, very limited in our use of any of these medicines in kids under 2. Almost none of these. Certainly Tylenol, or you could use ibuprofen after age 6 months for fever, but that would be about it. Now, so we want to do a lot of supportive care measures like cough drops, but not in babies who can choke on them. These are for older children. We can also do for older children some good old generic throat spray if their throat's very sore, or warm saltwater gargles. We can also do, my favorite in kids 12 months and older, is just plain honey on a spoon, or honey melted into warm liquids can be very effective. And remember, it's really soothing to melt that honey into some warm tea. This is my favorite brand, or my favorite flavor is Bengal Spice. So remember, with the littles who can't blow their nose yet, we really want to do some good mucus management to encourage fluids to thin the mucus. You can use saline drops in the nose, suction it out. You can do a cool mist humidifier. There's not a lot of evidence for that, but it does seem to help sometimes, or a steamy shower to help loosen some of that mucus. And they won't always be able to drink as much as normal, so you have to encourage small, frequent amounts. I hope this was helpful, you guys, and that made sense, and it'll help you be a more savvy consumer as you go to purchase cough and cold medicines. Thanks.